Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for irritable bowel syndrome. What is irritable bowel syndrome? Irritable bowel syndrome, IBS. Throughout this video, we will use this short term IBS. It may be interrupted with the dots, that is I.B.S. or IBS. Same, meaning same, irritable bowel syndrome. We will use this term. Is a common chronic functional disorder. Mind it, common chronic functional disorder. It is functional, not organic disorder of large intestine characterized by changes in bowel movements. You know, in bowel there is a nice movement. It's called peristaltic action. That action is disturbed here. And other symptoms. Here there is no change in bowel tissue. That is very interesting thing. That is called functional. There is no actual change. Bowel tissue. As such, no chance of any malignancy is there. In this connection, references to inflammatory bowel diseases, namely ulcerative colitis and Crohn's disease, far more potentially dangerous diseases, are often raised. That is, these two are raised side by side. But mind it, first one is the irritable bowel syndrome is a simple disease, functional disease, but the inflammatory bowel diseases are serious and may face some malignant situation. Now let us discuss this picture. Irritable bowel syndrome. Mind it, note it. This is the large gut. Note the large gut is in various places. It is shaped variously. It is here. It is too much inflated. That is, something is deposited extra. Constipation. That is, stool mass is accumulated here. Here, area of spasm. Spasm means that is contraction. Then again distended bowel. Finally, diarrheal movement actually. That is too much of fluid, quick moving, semi-solid fluid, stools passing. This is irritable bowel syndrome. In the bowel, various places is influenced by various abnormalities. Somewhere it is constricted, somewhere it is constipated, somewhere it is distended, somewhere it is diarrheic. The same picture is here also. This is spasmodic area, this area spasm, this area spasm. Areas are generally constricted, somewhere is distended. What are the signs, symptoms of IBS? Abdominal pain, cramps, bloating, wind, diarrhea, constipation, abnormal bowel movements. These common symptoms of IBS have been demonstrated here in the image. Same thing in some other words has been demonstrated here. Please check. What are the types of IBS? IBS is attracted by women twice as more as is attracted by men. That is, women are more affected by IBS and is developed generally before the age of 50 years. Research sources reveal that IBS is not a single disease, rather seems to connect it with multiple medical issues. It has the multiple forms. The forms are like this: IBS-C, that is irritable bowel syndrome, severe constipation. That is, this type of irritable bowel syndrome, constipation is much more compared to diarrhea. IBS-D, that is with diarrhea, much diarrhea, less constipation. IBS-M, M for mixed, both. A for alternating, both. That is partly constipation, partly diarrhea, mixed type. Number 4, post-infectious diabetes. The post-infectious IBS, that is IBS after some serious infection in the large gut. That IBS. Post-diverticulitis IBS, that is after diverticulitis IBS has come. Symptoms are nausea, abdominal pain, fever, constipation. In the previous post-infectious, main symptoms was diarrhea. Here, this is the picture has been shown here. When to call in a doctor in case of IBS? Following situations demand consulting a physician as early as possible. Gradual weight loss, persistent bleeding from rectum, persistent pain in rectum despite discharging of flutters and bowel movement, unexplained vomiting, difficulty in swallowing, diarrhea at night, iron deficiency, anemia. What are the causes of IBS? Precise cause is unknown. Following factors appear to play some role. Number 1, muscle contraction in intestine. It is said that weaker contraction favor constipation, whereas stronger contractions, stronger than normal, create bloating, gas, diarrhea. Nervous system. Nervous in coordination between gut and brain plays an active role in creating pain and discomfort. This is called a gut-brain connection. When this gut-brain connection is disturbed, this type of symptoms comes. Severe infection like gastroenteritis or abnormal growth of bacteria in intestine may flare up IBS. Stress in early life. Persons pass through stress in their early life, that is, while you are a child or boy or girl, are frequently tormented by IBS. Changes in bacterial flora of gut. Microbe residing in gut of healthy persons play an active role in maintenance of their health. Mind it, in our gut there is crores of bacteria living there. Bacteria, not bacteria, better it is said microbes. Various microbes, crores of microbes residing there, and many of them are helpful for us. Many of them. Sometimes dangerous microbes also reside there, then we fall ill. In case of IBS, some sort of that disturbance occurs. Research indicates that the microbes in people with IBS might differ from those in healthy people. That is, differ means these are some some dangerous type of bacterial flora generate in the gut of person affected with IBS. That is the disease actually. The person is diseased, so it occurs that's why it occurs. What are the triggers of IBS? Signs symptoms of IBS can be triggered by the following. Foods. Reports have been received from persons suffering from allergy that certain foods and drinks, that is triggers of in case of allergy, often aggravate the situation of IBS. Stress. People suffering from IBS reports that their symptoms flare up whenever they are in extra stress. That is, in extra stress condition, the IBS is increased. However, it has been ascertained from close observation that neither of allergy and stress can create IBS. They cannot create, but they can aggravate the situation, though each may modify signs and symptoms. This is some allergens have been shown, and this is a picture of anxiety depression. Who are at risk for IBS? Number 1, age. Persons below 50 years, mainly ladies. Sex, women are more vulnerable. Number 3, family history. Persons with family history of IBS are prone to get affected easily. Anxiety, depression, and other mental abnormalities play a definite role in setting IBS. Now, the remedies. Arsenicum alba for IBS. Disease returns periodically, travels more in midnight or midday, cannot bear the sight or smell of foods, stool like rice water or dysenteric, foul, small, involuntary, acrid, black, lilienteric. Lilienteric stool means the stool containing undigested food particles with much prostration, unquenchable burning thirst, drink small amount again and again, sensation of emptiness in stomach, still they do not feel like eating. Salicea for IBS, like ice cream, that like means the patients like ice creams, ice water, feel comfortable after taking this. After drinking water, vomited out. Voracious appetite but disappears on attempting to eat. Gnawing, twisting pain, epigastrium. Epigastrium region is this region. You know, the whole abdomen, this is the abdomen area. I am showing, this is the abdomen area. This has been divided into 9 quadrants. This is epigastrium, this is right hypochondrium, this is left hypochondrium, this is umbilical, this is right lumbar, this is left lumbar, this is hypogastric region, this is right iliac, this is left iliac. These 9 regions, this is the epigastrium region. Now, whether knowing twisting pain in epigastrium, worse by pressure, stool come out with difficulty, when partly expelled recede again. Sometimes diarrhea, offensive, painless, lenteric, like beer but not fish or meat, which do not agree. Intense heartburn, sensation of a load in epigastrium, shown epigastrium here, and throbbing at the pit of stomach. This is pit of stomach. Ferrum phosphor IBS. Undigested food particles in vomitus, bloody, water-like or yellow water-like stool are the keynote signs of this remedy. Sleep, restless and dreamy, great depression in morning, vomiting of ingesta. With abdominal problems, if there are fever, redness of face, intense thirst, this remedy never fails. Aversion to meat, milk, desire for sour things. Calcarea phosphor IBS. Pain in stomach starts just after intake of food. Body getting thinner day by day. Craving for salty, smoked bacon, ham. Call it at every attempt to eat. Stools foul, hot, spluttering, watery, green, slimy, undigested. Flabby, sunken abdomen. Subject's problem seem to increase when thinking of the disease. That is, when the person thinks of his disease, his symptoms appear to be increased. This is called USP. USP means uncommon, strange, peculiar symptom. These are very, very important symptoms. If you get this symptom, you can directly give this medicine, because this particular uncommon, strange, peculiar symptom is related to this medicine only. So one single medicine, one single symptom can help you to select a particular medicine. Lycopodium clavatum for IBS. Intestine flatulent from heavy farinaceous food or from vegetables. Farinaceous actually the various types of vegetable and just like you can say this is leafy vegetables. Too much of leafy vegetables. Constant sleepiness but sleep not refreshing. Desire for food but a little food satisfied appetite. Empty sour erection with sour taste of everything, even sweets. Rise up to the pharynx and burn there for hours. Heartburn. Worse from cold drinks, better from warm drinks. Incarcerated flatus. Flatus means wind, and incarcerated means this blocked. It is neither going up, neither coming down. Causing bloating with shooting pain across the right to left. Worse from 4 to 8 p.m. Cannot tolerate tight clothing over right hypochondrium. This is right hypochondrium. Palpitation during digestion, sensitiveness to gastric region, to pressure only after meal. Salicylic acid for IBS, flatulence IBS with extreme distension of stomach after eating, putrid flatus with temporary relief, vomiting characterized by same putrid fermentations, great irritability with despondency, anemia and severe weakness. Creosotum for IBS. Deep and lasting disgust for foods and drinks in convalescents from severe disease. Convalescent means the person who are gradually curing from some trouble. That type of patient is called convalescent patients. For least quantity of foods, drinks fatigue them equally. Then after several hours, food is thrown up undigested. Great and constant nausea with inclination to vomit but without actual disease. Cold feeling in the epigastrium internally. Epigastrium I have already shown previously. As if cold water, ice were there. Tension over stomach area. Cannot bear tight clothing. Water taste is bitter. Worse from cold, better from warm food. Weary from slight exertion, better after sleeping. Colitis for IBS. IBS due to nervous debility or too much of mental exertion. Unnatural appetite. Always feeling hungry but little food satisfy hunger. Again sometimes no appetite at all. Wind accumulates. Abdomen get distended. Palpitations after food. Burning near throat. Pain about stomach. nausea. Vomitus contains bitter tasted undigested food, sometimes blood, belching and farting of fetid wind, which gives them relief after food drowsiness. Crave for sweets, cold and sour drinks. Next form for IBS. Gastralgia. Foods lie like a stone in stomach. Pain moves to back and chest. Irritation, heartburn, waterburst, nausea. Mind it, heartburn, waterburst, everything is means acidity, that is burning at near throat. Nausea. Think if they could vomit a little. Bowels gripe here and there. Sore bowels. Flatulent colic. Strain hard at stool. First part soft, last part hard. Feeling as if a portion of stool remained back. Constant uneasiness in rectum. Crave beer, fatty food, stimulant, chalk. Hydrostasis for IBS. Empty aching. Gun feeling in stomach, worse from eating, large flabby, slimy tongue, sour eructation. This is the tongue of hydrostasis. Placing hand lightly on the pit of stomach reveals pulsation. That is, if you place your hand on the pit of the stomach of the patient, you will feel the pulsation of the heart. Fainting from exhaustion, pyrosis, same, acidity or heartburn. Burning pain in umbilicus with stitches in epigastrium, extending to testicle, appearing after stool with great weakness. This type of stitching pain in epigastrium, extending to testicles, appearing after stool with great weakness. This is information given. If you are interested, you can seek this book in the net. With this, the video ends. Thanks for listening, viewing. If you got any problem, please write out in the comment section. I will certainly respond.